Hi guys, I'm so excited to be here today. Do you want to know about the new 10-year healthcare plan that was released on the anniversary of the 77th year of the NHS and how it can impact on your nurse career? Please, if you're interested in that, do join and stick along. I've got three key points really to tell you, and I think all of them are important, so do stick along to the end. And I will also like to share with you something exciting that I've been working on for the last 3 months that I hope will help you as well in your nurse career. So, hi. For those that are new here, my name is Sabrina Phillips and I am a managing director in the NHS. I have over 21 years of experience as a mental health nurse and I've worked in many different roles. And today I just really wanted to come and share with you the three key things I think you need to know as a nurse based on the 10-year plan. And if you're thinking about your career trajectory or career development, how this can help with that for the next 10 years and beyond. So firstly, if you haven't seen it, please do Google the 10-year plan. I think it's about 130 pages. I am still going to be reading through it and getting to the real crux of it. But more importantly, I thought it was really key to let you know what the three things that the government, the NHS, Department of Health is planning in terms of healthcare for the next 10 years. And the reason why it's important to know this and how it can impact on your nurse career and what you might want to think of. So the plan very much gives us three key focus for the next 10 years. And the first thing is about prevention. And it's really key because they're wanting us to move from a sickness model to one where it's more preventative. So in terms of your own nurse career, it's maybe thinking about roles where you might get into areas where they're doing prevention, so things like public health, things like how you work in social care, things or currently how you work in an inpatient or community setting, and how you work with your patient to prevent further ill health or to keep them healthier. So that's a really key drive, is moving from a sickness to a preventative model. And there'll be lots of things that we can do and can learn from out there. So it's really key if you're thinking about your nurse career, about what you might want to courses you might want to go on, areas you might want to look at working in, or even places that you might want to shadow or things you want to read up on. The second area is about move away from acute to community care, or shifting care more into community. So firstly, don't think that means that there will not be any acute or hospital beds. Of course, we need hospitals. Of course, we need acute beds. There's something about how we focus the care where we know our patients are most of the time. So I work in mental health, and I know that although we've got a specific amount of acute beds, most of our patients live in the community. Most of our services are provided in the community. And going forward, there is a drive towards having integrated neighbourhood teams. So that's meaning about how we work together, not only in the areas that we work in, but how we work with primary care, so our GP general practice services, how we work with voluntary care sector organisations, how we work with, and I work in mental health, so think about how we link in the physical health care that is provided. And there's a number of different examples and options that are available. So in terms of your own nurse career, it might be thinking, if you're currently working in an inpatient setting, it's thinking about what transferable skills you have and how you can shift that into thinking about a community type focus. But as I said, again, there will be a need for acute beds. But what it might mean is we need to think about how we support our patients to get well quicker, to be stabilized better, so that we move them back into the community. And remember, I said that bit about prevention work. So again, what can we do to support our patients to improve their well-being and their health when they're not with us, whether that's in an acute setting and when they're getting better. So that's something to think about. And again, there are a plethora of roles across the NHS, where as a nurse you might want to be thinking about your own career, about if you're working on an inpatient ward, what skills can you use to expand into community, but also if you're working in community care, how are you going to think about working in partnership, in collaboration with service users, their carers, but also with other organisations that we work with, and how we create opportunities around that. The last bit, and this is really, really exciting, it is around how you move from an analogue system to one that's more digital. And for us nursing, I think this is where, we are going to be really important for this direction of travel. So there's lots of things about how nurses are supported to learn about artificial intelligence. So AI, that's going to be a really big thing. But the thing I think about is, how do we as nurses look at the systems that we work in that can feel quite admin heavy? And when I say admin heavy, I'm not meaning that in a derogatory way. You might think, oh, I've got to do this piece of work, but then I've got to go back and document it. And there'll be ways in which that we can use technology to help to do that, but also how we can support our patients to use technology to help us, to help them, but also to help them to keep well, to prevent ill health, to ensure that they are linking into community stuff. So there's talk about how we can potentially use wearable technology. I've got a smartwatch I'm wearing now. I count my steps every day. I look at my sleep. It's not great all the time, but there's things like that that we use in our everyday life that we can support our patients. And firstly, you might be saying, well, not everybody's able to use technology. Not everybody's got the money to use technology. And that is true. However, I think it's an opportunity for us to support those that are able to. But I think and this isn't going to happen right away. So it is a 10-year plan, which is great. So that means we have got 10 years to get to that. But I think it's an opportunity for us to help patients who can't use technology to be able to use it. And I think what that then does is frees up time. If people are then able to book in an appointment using technology, there is a real drive to use the NHS app. So again, it's thinking about how we support patients to understand what the app is, how we even understand what the app is and what we can do with it. Because again, in the plan, there's something about that being part of the front door of our NHS and people being able to access that. But what that then does is put at our fingertips and our patients' fingertips a plethora of potential information of knowing where they can contact services in their areas, where they can give us information, where they can hold their own records, because as we know, I work in the NHS, not all our systems talk to each other. So again, it is a really, really good opportunity. So for those of you who might be shy of technology, and we use it in everyday life. I mean, I use online banking, for example. I've just recently downloaded my own cards on my phone and find that really liberating. You have to take less things around. But I do get it. Not everybody is at that place. Not everybody is maybe as young as us and has grown up with things like that. We have to support those that don't know how to do it. But that opportunity bit, I think, is where we can support people to use it. It means that those that can't use it, that don't have access to use it, can then use the analog stuff that we do, whether that's picking up the phone at the moment to book an appointment, and that frees up that space for that, and it helps with wait list, etc. So if you're thinking about your own nurse career, definitely look at opportunities of how you can be more digitally, get more digital knowledge, get more into working with your patients around how we can use artificial intelligence. If there are any quality improvement projects that you've got in your trust, think about how you can support or be part of that. But more importantly, look at your current system where you are using paper and think, if I had to cut out the bits that absolutely make no sense, that adds no value to me caring for my patient, what would that look like? So that when we get to a point where we're then moving that paper process into an electronic process, it's the best process that we can put into an electronic process. Because I think the worst thing that we can do is transfer a paper process that's really bad into an electronic process, because we're just going to be perpetuating the same things. So those are the three key areas. It is about prevention, It's about that move from acute to community provision, and more importantly, it's about moving away from analog to digital, and that presents really good opportunities for you as a nurse to think about different areas that we can use our skills, because let me tell you, nurses will be needed, but we will be needed in a different way, and we can help shape that. So, at the start of this, I said I was working on something for the last 3 months or so. I have developed my own membership. It's called the Nurse Launchpad, and I'm looking at working with nurses in band 5 to 6 who are feeling stuck, who really want that support, that mentorship, that coaching. It will be a monthly fee. There will be also master classes, opportunities to be coached by me in a group setting, and also just the space where you come together with like-minded colleagues to really learn, to really grapple with your career, to get that support that you need to really skyrocket your career. So if you're really interested in joining me in the Nurse Launchpad, it'll be launched in the next two weeks or so. Please do click the link in the bio and sign up, and I look forward to seeing you. But I'm really excited for this 10-year health plan and how it's going to support us as nurses in our nurse career. And I just wanted to say thank you for joining me, and let's be bold and brave together. Do leave any comments if there's anything in here that really got you thinking, but also let me know if there's any things in here that I've said that you're already working on in your career. I look forward to seeing as many of you join my Nurse Launchpad, but if not, I'll see you on the next video. Take care and goodbye.